Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah, Manager, Workforce Development, Kaleida Health, and Executive Director of the Near East and West Side Task Force. Thank you, thank you for tuning into today's program. I greatly appreciate you. We greatly appreciate you. And as I always say, your questions in the community, please keep them coming. Well, our topic for this morning is diabetes and prediabetes, which I believe, and I'm just saying this, affects over 40% of the people in this country and has a greater impact on the African American community. However, I'll let our speaker, Kelly, in a few minutes address that question. Who is Kaleida? Kaleida Health. Kaleida Health, we are compassionate about all of our patients. We're compassionate about all of our patients in all of our facilities, including Buffalo General Medical Center, Millard Fillmore Suburban, Oishei Children's Hospital, Great Lakes Cancer Care Collaborative, DeGraff Medical Park in Niagara County, Olean General Hospital in Olean, New York, Visiting Nursing Association. They're located throughout the 8 counties of Western New York, and they provide medical service from the earliest day of life that person is home to the eldest person in life and while they're home. They also provide care 24 hours a day, 7 days a week. At Kaleida, we have 2 long-term care facilities, High Point on Michigan and Buffalo, and DeGraff, a long-term care, and that's also in Niagara County. We have clinics located throughout Buffalo, south and north of Buffalo, and Olean that treat adults, children, expecting moms, elderly. We do not discriminate, and all persons, I mean all persons, are welcome to our facilities, including our clinics. At Kaleida, we also continue to provide community outreach. And if you're searching for employment or you want to begin or change your career, please visit our website at www.kaleidahealth.org /careers. Again, that's www.kaleidahealth.org/careers. Anyway, on with our program. We have a lot to talk about. Our topic again is diabetes and prediabetes. And our guest, who is not only is she not a stranger to our show, she's not a stranger to the community. And her name is Kelly Cardamone. Good morning, Kelly. How are you?
I'm doing well, Francesca. Thank you for having me. Always a pleasure to be here.
Oh, you're welcome. And Kelly, I have to thank you publicly for sometimes when it'll be last minute, I'll say, Kelly, are you available? Kelly not only has her master's degree in clinical nutrition, I'll let her explain everything, but she's also currently working on the clinical part of her PhD, and she's doing clinicals now. And when I asked Kelly if she could do the show, she just said yes. However, I am swamped and I'm doing the clinical part of my PhD. And I'll let her say a little bit more about that. But Kelly is a clinical nutrition and diabetes program manager at the primary care general physicians. So, Kelly, anything else you'd like to say about the degree you're working on?
No, you know what? Just I'm always happy to help. And yes, right now I'm excited. I'm doing I have to do the residency part for my doctorate in clinical nutrition, and I'm doing it in gastrointestinal, so in GI with our group at General Physician, Dr. Corsanti. So it's wonderful because I think it can enhance what I've learned. And just that I've been a diabetes educator for almost 14 years and been in the field for 25 years. I just love what I do, as you know.
Yes, and I tell you, and we will talk offline if you can do a program on GI and on GI disease, because that's another area that a lot of people have questions on. But today's topic, diabetes, education, and family members. listeners, the reason I'm including family members, because many times if someone is diabetic or pre-diabetic, they may not always be telling you the truth on what they can have, what they should avoid. And that's why I have Kelly on here. So Kelly, what is diabetes? And roughly, do you know the percentage of people who have diabetes or diagnosed with pre-diabetes?
Yes, absolutely. So to put it very simply, diabetes is basically the body is not handling the carbohydrates or its food properly. How about that? To put that very simply, and it has to do with insulin resistance or the body not producing enough insulin. And there's a multitude of risk factors that that put people at greater risk. But to look at the percentages, according, to the CDC, the Center for Disease Control, currently right now in the United States, there are 38.4 million Americans with diabetes, and that's about 11.6%. And the interesting part is about 29.7 million are diagnosed, 8.7 million have it and they don't know they have it. So that's the diabetes part. If you're looking at pre-diabetes, as you had mentioned in the beginning,
That's
we've
just
got about
diabetes?
11. Oh, sorry.
That's just the diabetes? I thought that was everybody. So
No,
38.
that's just diabetes.
Oh gosh.
That's
Okay.
Yeah. So now to give you even a larger, more impactful number, looking at pre-diabetes, we have approximately 97.6 million Americans, people that live in the United States have pre-diabetes, and 80% of them don't know it. So as you had stated earlier, we've got about 40% of the population with diabetes and pre-diabetes. And it really does with it, comes a whole host of things that you have to watch out for because it does impact your entire body.
Okay, so we have 97.6 million Americans with prediabetes. 80% aren't aware of it. So
Right.
if someone has prediabetes, this set 97.6 million, why should they be concerned about having prediabetes?
Because that is, you'll see some places where it'll say don't let it, fool you or pre-fool you. It is basically the start. You have the potential to turn into diabetes. It's really where we start to see insulin resistance and the body is not quite, I'll say optimal at that point, meaning if you're looking at health, and it puts you at a greater risk for diabetes. And behavior is a huge part of this, and lifestyle choices, diet, exercise, things that are modifiable or things that people can change. And the CDC states that basically, two-thirds of individuals who have prediabetes can prevent it from turning into diabetes if they make the right lifestyle choices right away. A lot of times you'll hear, oh, I'm going to wait and see what happens, or people feel okay and I'm fine. And you can't, if you have that diagnosis of prediabetes, you have to take it seriously and you have to act right away, immediately, and change some things that you can to stay healthy.
Mm. Okay, so okay, I just had blood work done recently. And is there, if someone has a higher, what is it, the elevated number, what is it, your glucose?
So there's a couple things that are looked at, and the two main lab values that you'll see is a fasting glucose, and then you'll also see hemoglobin A1C, and that's the average blood sugar over 3 months time. And so those two things are really looked at to see if someone meets the criteria for prediabetes or diabetes.
So what number should, if it's above, should someone?
Sure. So please note that, if someone's at home and they have access to their lab values, that if, these are things that if you check them and you say, oh my, it meets the criteria that I heard, on the radio, always speak with your provider about it because they look at, it has to be either two separate occasions or lab draws, or there's certain criteria that we're looking at. So your provider should be monitoring that closely. But for instance, fasting. And the key to that is fasting glucose. So there's certain criteria if you've eaten and had blood work done, But if you've been fasting, ideally 12 hours, but fasting, when your blood sugar is between 100 and 125, that is an indicator, it can be of prediabetes. 126 and higher is an indicator of diabetes. The hemoglobin A1C, and I'll have patients that say, well, I ate, a lot of pasta or donuts the night before, and then I had my A1C checked. The interesting thing about that hemoglobin A1C is that it's really not impacted, even if you did eat something that morning or the night before or several days prior. It is a 3-month average of your blood sugar or blood glucose reading. And that for prediabetes, if it's between 5.7 and 6.4, that's prediabetes. If it's 6.5 and higher, then that meets the criteria for diabetes.
Wow. Okay. All righty. Okay, thank you. I don't want to I don't want to digress. But that's good to know. You teach diabetes education, correct?
Yes.
And really that's a part of the show today that made me think I needed you back on the show. Let's talk about diabetes education class. And is it diabetes or is it pre-diabetes? And the big thing when I talked about earlier, can someone bring a loved one, a friend, someone as a support to that class with them?
So absolutely. So the classes that we offer through general physician, and they are open to the public. So if you are part of the general physician, if you have a primary care doctor or doctor and general physician or not, you can attend these classes. So once you have a diagnosis of diabetes, you can attend our classes. We have an accredited diabetes program through the ADCES, which is the Association of Diabetes Education Specialists, and I should say care and education specialists. So we have an accredited program. It is a 4-week series. And they're 2 hours every week we meet. So our team of dietitians who are all diabetes educators at General Physician teach a bulk of the classes. And then we have our pharmacy team that teaches the medication portion, which is one of the classes. But a lot of times people think it is just medication or just diet and medication, but these classes really are all encompassing of these what they call 7 healthcare behaviors, but it's monitoring, it's coping skills, it's exercise, it's stress management, it's medication and food. We really teach we teach our participants about every aspect of diabetes because it provides clarity, but education is powerful. Now, to go to your question, yeah, and it gives you the tools. We give you the tools because you are the person that is managing your diabetes or prediabetes the most. And we encourage you to bring a family member with you to attend the classes so you have support. We also offer the classes via telehealth or online, which is a great way to really get a lot, the whole family involved. I tell everybody, have a diabetes class viewing at your house, but when you're attending the class, anybody in your household really can attend the class and learn as well. So it's a great opportunity to reach a lot of people in the community.
And you know what? And it's like a diabetes a diabetes education viewing party with carrots and some celery.
Exactly. Exactly. I do want to also share, because you had mentioned, about prediabetes. The CDC had created a prediabetes program many years back, and there are a lot of places that run prediabetes programs as well out in the community. I know the Y has done them. I believe the Jewish Center has done them as well. But there's a lot of community centers that run these prediabetes programs. We currently do not. We do not offer those programs. Ours is focused on diabetes.
Yeah, and I also want to mention, because you mentioned a few times, the CDC. So I just want to make sure everyone knows that stands for the Center for Disease Controls. That sets a lot of policy in healthcare for the country. Is that good way of putting it, or do you want to add?
Yep. Nope, that's perfect.
Okay. All righty. How important is reading a label. And I know I've mentioned this before on shows, and my listeners may say, oh no, here she goes again. I just remember the time recently in 2024 at a store, and there was a brand that had four different kinds of chicken noodle soup, and different names, but still all chicken noodle. But the sodium content was different on each one of them. My point being, I was reading the label, and how important is reading a label and tying into keeping your numbers down for diabetics and pre-diabetics? And what are the things that we should be looking out for as if when we're reading a label?
Sure. Great question. And it is something that we spend a lot of time on in our education classes, and even when we meet with patients one-on-one. You want to know what you're putting in your body. As we all know, food is medicine, and we state that. And a lot of times we get really, how do I want to say, swayed by what's on the package or on the label, meaning the pretty stuff. They'll put some claims on there. They make the package look good. They want to make it enticing. And I tell you to avoid all of that. And you need to go to you need to avoid it. And you need to know it's marketing, right? Even where they place the food on the shelf. And you want to go directly to the nutrition facts panel. And, I even teach my children to do this because you want to know what you are putting in your body. So you would ask the question, what's really important? And I just also want to stress the reason the nutrition facts panel is important is a lot of times patients will come to us and they're like, well, which, is the best bread or the best crackers or the best. And the problem is, if you are in a store and I give you a name brand and you cannot find it, and you may not have access to drive to 3 other stores to look for it. And so this is a tool that you can use when you're traveling, when you're visiting family, out west, down south, wherever you are, and you have to go to the grocery store. Even when you go out to eat and you're at, a fast food chain, restaurant or somewhere, look at the nutrition information. So first and foremost, there's some things that are extremely important with diabetes because of looking at insulin sensitivity and how the body utilizes the carbohydrates. It's one of the first things you should go to on the label. Of course, look at the serving size and calories and things of that sort, and consider price, by the way. I know that's super important. But I tell everybody, and actually diabetes or not, the first thing you should look at is total sugars. I've had patients that they just look at the carbohydrates, they just look at the total sugars, or they just look at sugars. I had a patient the other day that was taking the total carbs and adding the sugars on top of it. And here's how this works. Total carbohydrates is an umbrella term, let's say. And underneath that total carbohydrates, you're going to have total sugars, added sugars, fiber. But when you go to the total sugars first, it really eliminates a lot of foods out there that are not healthy. And the rule I've used with patients for years, because I think it's simple and it works, is I tell them single digits on the sugar. So 0 through 9 grams is okay. 10 or more, try to avoid or find another option. Unless it's something you're eating, once a week, it's okay. But if this is something you eat every day, even for your family. So I tell you, double digits, don't do it. So if it's 10 or more on total sugars. Now with that, people look and they go, well, there's added sugars underneath total sugars. And I say, yes. What that means is out of the total sugars number, a certain amount of it was added sugar. So think of just taking sugar and adding it to the product. So for example, if you picked up something and it said total sugars was 12 grams and added sugars was 10 grams, out of that 12 grams, 10 of it was added. Maybe it didn't really need to be in there, right? 2 of the grams were natural, and that would be a lot of foods have naturally occurring sugars, fruits, vegetables, your grains, and it doesn't mean that they're bad for you. So you want to look at total sugars. The other thing you should look at is fiber. We do not get enough fiber. We should be getting around 20 to 25 grams per day of fiber. Americans, or those in the United States, do not get enough. So my rule is 3 grams or more. If you're buying crackers, pasta, rice, bread, snacks, granola bars. So you look at sugars, you look at fiber. Now, should you look at total carbohydrates? I will tell you that's a little bit more complex because it depends on your size, your specific nutrition plan. So I'm actually going to tell you the next thing you should really look at is saturated fat. Diabetes puts you at higher risk for heart disease and heart attack and stroke, and we have to watch your cholesterol. And so saturated fat, I tell you to keep it 3 grams or less per serving because you don't want to exceed 15 grams or more per day of saturated fat. The last thing, and again, you could look at various things if you've got, if you're on, you have more significant or progressive kidney issues and things like that, you might be looking at other things on the label, but I tell you to look at sodium. Ideally, you should have no more at 2,300 milligrams per day, really is the maximum. Some individuals it'll be recommended 1,500 milligrams or less because you have kidney disease or high blood pressure. But even if we keep it around that 2,300 milligrams, on the label, ideally lower sodium products are best. I recommend looking for things that say 200 milligrams or less. And that kind of gives you, again, I've done this through the years because it gives you the opportunity to buy products that are most likely within your budget and that you can find in any store out there.
Yes, yeah, no, thank you. I agree. And that includes, I mean, and when you're looking at that, you have to also include, number one, you have to be honest with yourself. If you can, have either a food diary or put something on your phone, because we're not even talking about drinks, sport drinks. We're not
Right.
talking about soda slash pop. We are not talking about wine. So these are just things to consider, and I'm sure are covered in the diabetes education class. Because we only have a half hour, so we're just scratching the surface. I asked her about food labels. We didn't even, like I said, we did not discuss pop. We did not discuss sugary drinks, nor did we discuss alcoholic beverages that also have sugar, also have carbs. So that's just Kelly, if someone is interested in your diabetes education class, what should they do?
So the best way if you can go to the general physician website and our classes are posted online there, but there's also the number that you can call to register for classes. That number is 716-800-2273. So that's 716-800-2273. Basically, it's 800 CARE is what it spells out. And it is option 5 or 6 you can choose for those classes. You do need a referral from your primary care physician to attend the classes. But I have yet to find someone whose doctor, would not provide them with a referral for these classes.
Yeah. And I have to say, having interviewed individuals who work with Feed More or some of the food pantries, even some of the food pantries are now beginning to provide labels, the nutritional labels of food that they're providing. And if they don't have it, ask them because some of the smaller pantries still receive their food from Feed More. Just ask them, can they possibly get that information? There's never harm in asking. I know we're winding up the minutes here. How about organs? What organs are impacted by having diabetes or prediabetes, which lead to disease?
Absolutely. So, in a nutshell, diabetes really affects almost every organ in your body. And you have what they call, if you've ever heard the term, they say micro and macrovascular. What that just means is we've got these large blood vessels that are impacted, put you at greater risk for coronary artery disease or basically heart disease and stroke. Having diabetes puts you at 2 to 3 or more times the risk of the person without diabetes for heart attack and stroke. It also impacts the brain, by the way. The smaller vessels, they call it microvascular. We're talking it's going to impact your kidneys. It's going to impact your eyes. It's going to impact your nerves. So if you're looking at neuropathy, people get tingling in their fingers and their toes. Bottom line is it impacts every organ. And so does prediabetes. So even if it doesn't progress to diabetes, prediabetes still impacts these organs.
Wow. Say that one more time, just one more time, because that's so important. The organs that are affected and or
Yep.
the disease. If you could just say that one more time, please.
Sure, yes. So the organs that are impacted by prediabetes and diabetes, of course, more significantly with diabetes, but it puts you at it impacts every large blood vessel, in your body. So it puts you at higher risk, 2 to 3 or more times a greater risk for heart attack and stroke. So heart disease it's going to impact your heart, right? And then it also impacts the smaller vessels, so impacting the vessels of your kidneys, of your eyes, and of your nervous system. And prediabetes and diabetes impact both of those, and your brain. So it's your heart, your brain, your kidneys, your eyes, your nervous system. It impacts everything.
Okay. And then also, and that'll be like another show. Does diabetes and some of these foods also impact your eating, your gastrological system, your indigestion? Any of those terms that might be familiar with their listener? Just
Oh,
in
sure.
preparation for the next show. I'm just getting everyone ready for our next show.
Absolutely. So foods, and even by the way, diabetes, because it impacts the whole body, can cause what they call gastroparesis, which is basically the food doesn't move through you as quickly. But any of these foods can make reflux, is so common. So diet impacts reflux. But what you eat impacts what they call, if you've heard of it, your microbiome. It's basically the bacteria in your gut. It's your immune system. And what you eat absolutely directly impacts that. So, yeah, it is all connected, every aspect of it.
Okay. Anything? Let's get your phone number one more time for diabetes classes. Yes.
Yes, it is 716-800-2273 or 716-800 care, is what it spells out.
And Kelly, I'm going to leave it at that because I know I'll have you back in like another month and a half or so. Because this year I want to make sure you have to hear a message 10 times. And we probably have heard Kelly at least 5 times. So I just want to make sure our listeners understand diabetes, prediabetes, acid reflux, so they don't have to take Prilus or have to take any of those antacid pills all the time. And it's just important for our health. And that's why we have this program. Kelly, I want to thank you for being with us and good luck with your research. And I look forward to hearing more about the research that you're doing. Being one who has some of these gastrological conditions, so I want to thank you for being our guest here on the Great Lakes Health Radio program.
Great. Always a pleasure.
Yeah. And listeners, please stay tuned because we have part 2 coming up momentarily. Thank you for listening to the first half of our program here on WUFO, Power 96.5 FM, WUFO 1080 AM. If you're just tuning in for the second half of our show, Great Lakes Health radio program, I want to say again, good morning, good morning, good morning, and welcome to the second half of the Great Lakes Health radio show. I'm your host, Francesca Messiah from Kaleida Health, Manager, Workforce Development. And our topic this morning, we are going to be talking about a upcoming seminar at Millard Fillmore Suburban Hospital, which is a Kaleida part of Kaleida Health. And there is a workshop coming up or a lecture on non-surgical prosthetics for partial and complete hair loss. We are talking quite a bit about individuals going through cancer, men, male or female. However, this is for anyone who is losing their hair, or I guess has lost their hair. These are some of the questions we'll be asking today with our first guest, Duana Mumm, Good morning, Duana. How are
Good,
you?
good morning, Francesca. I am doing very well today. Thank you.
Oh, good. And Duana is we go way back. However, she's now currently with Kaleida Health Pastoral Care and the Great Lakes Cancer Care Collaborative, and founder of the Munn Hair Replacement System. And also we have Isadora Harrison. Good morning, Isadora. How are you?
Good morning. I'm doing well, thank you.
Thank you. And Isadora, you know what I don't have? I don't have your title. So if you could let our listeners know, what is your title?
I have a master's in biophysics. I am a trichologist, which is a hair loss specialist.
Oh, thank you. Because when I saw that, I didn't know what that was. So I've already learned something new today. Well, let's get on with our program. First of all, what is the name of the free seminar on February 29th from 6 till 7 p.m. at Millard Fillmore Suburban? So the first part of the question is, what is the name of the free seminar on February 29th? And the second, why is this topic important?
Yes, well, you've already nailed it. The name of the seminar is Non-Surgical Prosthesis for Partial or Complete Hair Loss. We feel that it's important because there's different reasons for hair loss when patients are having treatment, and we're going to go into that in depth as well as options during the seminar.
Okay. Um, and so hair loss, and we know that even though everyone says one of the new buzzwords is this is a non-judgmental zone, we don't judge, but we know people are judgmental just by nature. So why would someone be without hair thinking that there's no hope for them? Why would they be interested in this topic and attending the seminar on February 29th at Millard Fillmore Suburban? And is it cancer patients only?
Right. Yes. This seminar is for individuals, cancer patients that have completed their treatments, whether it's surgery, radiation, chemotherapy, or patients with metastatic diagnosis requiring, long-term treatments. The attendees there will learn about the options for, complete or, again, partial hair loss, as well as options through insurance and things like that. But what I've discovered briefly just through research and development, it depends on the type of therapy, the type of chemotherapy that patient is receiving to determine if they may or may not experience hair loss. And even the doctors aren't really quite sure as to why, some people, you know, end up with hair loss and some don't. It's a very wide topic, one in which I'm not a doctor, so I can only go by the literature and the literature review. But our seminar is really designed to help patients to know the different options that are available while they're receiving or recovering from treatment.
Mm-hmm. And then, um, and I want to say, is it also open to family members? Because that person who is recovering from cancer or in cancer treatments, they may be too tired to attend at 6 p.m. or 7 p.m. The seminar that is from 6 p.m. to 7 p.m. So can a representative come in their place?
I am so glad you mentioned that, Francesca. As we know, cancer diagnosis affects the entire family, particularly the caregiver. And to your question, yes, yes, yes. Definitely attend. If your loved one is not able to attend, that is a patient, definitely come, receive the information, and be encouraged along the way. Yes, definitely.
Thank you. And I want to ask each of you ladies, how did you get involved in this topic? I'm going to let Isadora go first. Isadora, how did you get involved in this topic?
Well, I do not have, I can't say that I have anybody that, had cancer and went through chemotherapy, but owning a manufacturing hair company, I come across, and I also dealing with hair loss and trying to help people with the growth of their hair. I come across a lot of people, men as well as women, who are suffering from hair loss from different types of, diseases, ailments, medications, and that sort of thing. So, the interest is there because these people are suffering from low self-esteem because of that, like you mentioned, people being judgmental about hair loss and that sort of thing.
Mine is a bit more personal. My mother, when my mother was first diagnosed with ovarian cancer, I was in the office with my mother the day she received her diagnosis. And the day that she received her diagnosis, she was already in stage 3. So she had to endure a very, very intense, aggressive chemotherapy treatment. And I was with her along the way. Now, prior to my mother's diagnosis, I was her hairdresser, right? And so after receiving chemotherapy, I received a phone call from her early in the morning, maybe at around 5 o'clock, 5:30, maybe 6 a.m. in the morning. And she called me and she said, my hair is all over the pillow.
Yes, yes,
And I
yes.
thought, oh, Mom. So we went out. And of course, we had so much support from the American Cancer Society and different resources that help patients, that are going through chemotherapy. And one of the problems that I came across for my mom, or that we both endured, was that there really weren't any prostheses that would match what her lifestyle and how she liked to look. My mother was a professional woman. She worked for the Board of Education. She liked to look good. She was 55 in her diagnosis. So now that I'm in my late 50s, I consider she was young then, although I thought she was older. So she still wanted to keep, a sense of fashion. She wanted to look right. She wanted to, right, exactly. And so when we got out there, my mom was like, oh my God, these units, they look like they're for old ladies. And so through all of that, I've decided, now that I've come across my own clients throughout the years that have suffered hair loss, I've decided to team up with my wonderful business partner, Isadora. And now we have the ability to not only manufacture hair units, but come as close as possible to your natural hair texture as possible. And that's really how my, MUN replacement systems, hair replacement systems was found. It was really founded out of, and by the way, my mother, she just ended up getting regular wigs from the wig stores, not prosthetics, and using safety pins to try to attach them securely to her head so that she could still have a sense of style.
Right, right. Yes. And you share that story. You just gave me a flashback to my aunt who had ovarian cancer. And I'll never forget when she was wearing a turban because her hair was falling out. And finally, I remember just taking clumps of hair. And she just said, next time I came to visit her, just bring her the scissors. Mm-hmm. I mean, so you have really gone down and really made me remember what that was like, because there was no option. I mean, I think when I first heard about this through your colleague, Melissa, I said, I have to have her on the show right now. So speaking of having you on the show, so what are the things that you want participants to understand? What are some of the fear? What are some of the things? Because even when I began researching this, I was researching the wrong area. I was researching surgical, and then I read that what you were doing, and I said non-surgical, and there's not a lot of literature. Maybe Isadora can talk about the literature on this whole, or you, one of you or both of you, please share. What is it? Okay. Some of the things participants will
come I'll start off with the topics and then let Isadora fill in. Basically, what you'll learn at this seminar, you're going to really learn about the science behind hair loss option and the options for oncology patients with thinning hair. Okay. And then you're going to learn about, why some chemo treatments generate hair loss while other therapies do not. Also, caring for your hair during and after treatment, critical. And lastly, our non-surgical options that are available for temporary or permanent hair loss. And then, Isadora, if you can pick up where I left off at, please.
Yes, definitely educating people on what is really happening to them, because there are a lot of people in these situations that are not confused and they do not really know what is going on with their bodies. So there's going to be the education of what really happens, and then that falls into what we can do to help them with helping them to try and regrow the hair if that is there, or helping them with prosthetics that not just being styled, or the style, just like Joanna said her mom was concerned about style. The style is there, but most importantly, the comfort, because there are lots of prosthetics out there that I've had people that come to me and they go from shop to shop to shop looking for something that fits them and is comfortable, because in chemotherapy there are all kinds of things that happen to people. The scalp is very sensitive, so they need pieces that are comfortable for their heads, that they're not itchy, they're not burning, they're not overheated. So that is our role in helping someone in that situation to be comfortable and stylish and have, the best quality of materials to work with.
So if someone is undergoing chemo, when would they come and speak with you? Before? I mean, like during the treatment, or before the treatment, or after the treatment? When is there an ideal time?
That's a very good question. That's an excellent question. From my knowledge and from my experience, sometimes patients before undergoing treatment will have a conversation with their oncologist, and some will start cutting their hair prior to treatment. I just spoke to someone maybe 2 or 3 days ago who said that they have already ordered their units prior to even starting chemotherapy. So I think now, as opposed to back in 2002 when my mother was diagnosed, I think there's a little bit more now available, and people are almost, from my experience, are almost preparing themselves for hair loss. I would encourage people to seek out solutions prior, during, and even afterward for hair solutions. What do you think, Isadora? What do you think about that?
Well, I think that that's a good idea for them to begin doing that. Although there are some people who they do not want, let's say they're in denial. They do not want to think that that is going to happen. And it doesn't always happen. It's not in every case. Some people don't lose their hair. It depends on, the treatment they're going to get. So I guess after they've spoken to their doctor that will tell them what to expect and whatnot, the idea would be to, get samples of that hair out there, so that if in case they need to get prosthetics, that it's available for them.
Can you do, I'll just start with this question. What if someone wants a natural hairstyle with braids? Can you do braids?
We can do anything at all.
You can do twists and braids.
Couture. Couture. Aesthetics.
And what is it? And what is that word again for, what was that word that for hair, studying hair? What's that word you use as a
Trichologist.
Trichologist. Yeah. Okay. All right. That was, that's okay. That's just one of those words that it threw me. So if someone has, let's say, blonde hair, so they would cut a sample of their hair ahead of time for the color and then make an appointment? How does that work?
Yes, you will give a sample of your hair and send that in, and the hair your hair will be matched accordingly. Even if you didn't have a sample, and let's say you may not want to to cut your hair or something like that, a picture or looking at it visually, I can match that to what you have. Now, trichology it's got nothing to do with being able to manipulate hair. It has to do with the biology, the anatomy. That's what it's about. The anatomy of the head, the skin and, things like that, how the hair grows, what happens, why the hair doesn't grow. That's what trichology is about. The other part of manipulating hair to any texture, color, and that sort of thing is my hair manufacturing part. That's a different section. It's a different learning. So I manufacture hair, being able to manipulate it to any kind of texture, color, salt and pepper, any texture that a person has, that can be done.
Now, also, if a person were to decide they want to have a prosthesis and they were saying, well, maybe I would like to have a little highlight this time, I also have swatches. Now, the swatches are just to kind of give an idea of the different colors. For instance, if someone had dark brown hair and they say, well, I want a little bit of highlight in the front area, I would say, I would show them the swatches, which are just general colors. And they say, okay, I like this number 27 honey blonde, and I'd like to have a little bit, maybe 20% of a little highlight in the front and things like that. But basically, there are many ways for us to not only give our clients and patients what they're looking for, but through the consultation and through coming in, we can really, we have the ability to really map it out specific, as opposed to just buying something off of the shelf that's already been pre-manufactured. That's the difference.
And in this case, I'm talking about, well, number one, two questions. First question, is this for men and women? And secondly, do you have pieces you can clip on? St. Patrick's Day is right around the corner. Someone with their new hair, they may, with their hair replacement, they may want a little touch of green in their hair.
Yes, definitely, of course.
And is it for men? Because men are just as, they like their hair as well.
We have male clients, mm-hmm, as well as women. Children and teenagers.
Children and teenagers. Wow. I wasn't thinking of it. Okay, just a side. Do you have a podcast? I mean, this is such a fascinating topic. I can just see people who are listening to the show today, who are coming to your seminar, on your free seminar, February 29th at Millard Fillmore Suburban. I can just see people with so many questions. How do people get in touch with you between now and,
Sure. They can contact me. They can go on the website at munhairreplacement.com. I'm located at 1 North Cayuga Road. Actually, my business says Mun Skincare because I also do aesthetics work as well. So we're located at 1 North Cayuga Road in Williamsville. The phone number is area code 716-803-3964. Come, or if you have any questions, we can address your questions. We are growing the business. So far, we're what is it? A work in progress, and we're growing the business and hoping to, really give out great information to people that will be most effective and life-changing, and trying to get things in order in terms of podcasting and things like that. Yes.
I'm sorry. Go ahead, Isadora.
We are pending in getting our what is it?
Our insurance?
Yeah,
Or
our
the
insurance where Medicare, Medicaid,
Medicaid,
where
yeah.
we the individual or individuals do not have to come out of pocket with paying for prosthetics if they are, suffering from cancer or a lot of things, but they will be able to pay from their insurance.
Or finance, or they can finance if their insurance won't cover, then we also accept financing as well.
Mm-hmm. What are some of the most more common questions that people ask you? It could be a question I've even asked today, that a question that you find that is a common question that comes from the patients, or not patients, customers. These are customers.
Well,
you go ahead. I'll let you take that one.
Well, how long will the hair last? How often do I have to come? Things like that. So some people ask on the medical side, do you think my hair will ever grow back? Questions like that.
A lot of people ask me, what can I do? What can I do to get my hair healthy? And of course, I talk about diet, what we're putting in, how you're feeding the nucleus of your red blood cells. Now, we know that the chemotherapy, we know that they go in and they destroy the bad cells, but, the good cells also can, be damaged through therapy. So, people want to know, how can I get better overall and what do I have to do? And they also want to know, which I can't give them the answer, how long do you think it will take my hair to grow back? Everyone is different. But those are the kind of questions that I have come across.
And again, I'm going to go back to the seminar. I'm sure these are the types of questions, to hear answers to these questions, because we're almost out of time. We don't have enough time to answer the questions, but you can ask these questions, listeners. You and your family, your loved ones, you can go on February 29th. From 6 p.m. to 7 p.m. at Millard Fillmore Suburban. You can ask these questions to Duana and Isadora, and it won't be you'll have more than a half hour.
Mm-hmm. The only thing we ask, though, is that you RSVP by February 29th, because we're going to have some things there for you. And if you can RSVP to Melissa Wanzer at MEL, Melissa, MELISSA, Wanzer, WANZER. That's her name. I'm sorry, that's her name. Her email is M as in Mary, B as in boy, Wanzer, WANZER at KaleidahHealth.com. I'm sorry, .org. I'm sorry, KaleidahHealth.org.
Or call. Who would they call?
They can call myself, Duana Munn, at area code 716-803-3964. Or if it's easier to email me, please feel free to email me at Munn, MUNN Skincare, SKINCARE, at gmail.com.
And if you can call, you can probably send a text as well.
Yes, and that way we will be prepared for you. We'll start exactly at 6 o'clock, and we will look forward to seeing everyone there.
and take pictures for Kaleidoscope.
Yes.
And Isadora, you had a comment before we have to end the show?
Oh, no, I was going to say, he said RSVP by the 29th. I was saying maybe before the 29th, so that you...
That's the latest, right? Exactly. You're right, Isadora. See, Isadora likes order. That's right. RSVP before the day of. Okay, that way we can govern ourselves accordingly. Thank you, Isadora.
But just in case it slips your mind, you are still welcome to come. They may run out of some of whatever it is, but
yeah.
But if you if something changes in your schedule and you realize that you can make it on the 29th, please come. How long does it take for, and I'm doing really quick answers. How long, if someone has medium length, dark hair, how long does it take to make a hair replacement?
The length of time depends on That's why an analysis has to be made.
Mm-hmm.
Depends on the thickness of the hair, the density, style and that sort of thing. So we have to analyze and take a look at everything before we can actually give a time frame.
And with the hair replacement system, I know listeners, you can wash your hair, so you don't
Yes,
have
of
to.
course.
You don't have to.
Oh, 100% human here. We do
Yes,
not do anything synthetic. We don't believe in harmful synthetics. No blends, 100% human hair.
definitely.
Okay. One last word on why people should come on the 29th, because we have less than a minute. Isadora, you go first.
Come to the seminar. We've got answers for you. It is going to be enlightening, educational wise, and physically. It's something you should do, somewhere you should be.
Okay, Duana, only one word. Why should they come?
Come touch, feel.
And be educated and know there are options. Know there are options. I want to thank you so much, Duana Mum from Kaleida Health, Pastoral Care, and the Great Lakes Cancer Care Collaborative, founder of Mum Hair Replacement, and Isadora Harris. Many degrees, biology, I know was one of them, and biology. I want to thank you. I want to thank you for also being a guest today on the morning on the Great Lakes Health radio program. Thank you, ladies.
Thank you for having us. Thank you so much.
You're welcome. And next week you'll hear from my esteemed colleague Cindy Bass from ECMC, and in 2 weeks, God be willing, you'll hear from me, Francesca Messiah, Kaleida Health, Manager of Workforce Development and Executive Director of the Near East and West Side Task Force. Bye-bye.